Health Detectives. Welcome back to Krones WellNest, where we love decoding the mysteries of our bodies. Today, we're diving deep into the cardiovascular code to unravel a question that often confuses many: stroke versus heart attack. It's like comparing apples to oranges, but these apples and oranges can have life-altering consequences. So, stick around as we break it down. And, of course, if you enjoy the investigation, hit that subscribe button for more health insights. Let's get started.
Heart attacks and strokes are some of the leading causes of death worldwide. They not only take lives, but can also leave lasting disabilities. However, there is hope, and the power to reduce your risk lies in your hands. Frightening medical emergencies, but they're distinct in their causes, symptoms, and outcomes. In this video, we're breaking down the key differences between a heart attack and a stroke, so you'll know how to recognize and respond to each. Stick around, you won't want to miss this. Before we dive into the differences, let's understand that both heart attacks and strokes are critical medical events that can be life-threatening, but they target different parts of the body. Let's start with heart attacks. A heart attack, also known as a myocardial infarction, occurs when there's a blockage in the blood vessels leading to your heart. This blockage can be caused by a blood clot or a buildup of plaque, leading to reduced blood flow to the heart muscle. The blockage is primarily made up of fat and cholesterol, known as atherosclerosis. Atherosclerosis can cause ischemia by restricting blood flow to the heart. In addition, if a piece of plaque breaks off from the artery wall, a blood clot may form, which can block essential blood flow to the heart muscle. Recognizing the symptoms of a heart attack is crucial. The primary symptom of a heart attack is usually chest pain or discomfort on the left or middle part of the chest that lasts for more than 3 minutes. This pressure can feel like squeezing, fullness, pain, or pressure. Other symptoms of a heart attack can include lightheadedness, jaw, neck, or back pain, pain in the shoulders or arms, shortness of breath, tiredness with no cause, nausea or vomiting, sweating and heart palpitation. Men and women can experience different symptoms during a heart attack due to various factors, including physiological and hormonal differences. It's important to note that not all men and women will exhibit these distinct symptoms, and some individuals may still have shared symptoms. However, the following factors contribute to the variation in heart attack symptoms, such as hormonal differences, coronary artery size, variation in plaque buildup, atypical symptoms, and delayed diagnosis. Symptoms more common in women are dizziness or nausea, unexplained weakness, recurring chest discomfort, sense of impending doom, anxiety, discomfort between the shoulder blades. While symptoms more common in men are standard chest pain and a squeezing sensation that may come and go, rapid heartbeat, stomach discomfort, shortness of breath, dizziness, and breaking out in cold sweat. It's important to remember that heart attack symptoms can vary widely between individuals and may not follow these gender-specific patterns. What's crucial is recognizing any unusual or severe symptoms and seeking immediate medical attention. Public awareness campaigns aim to educate both men and women about the symptoms of heart attacks, regardless of gender, to ensure early detection and life-saving treatment. What leads to a heart attack? The primary cause is the blockage of coronary arteries, usually by a blood clot or plaque buildup. Coronary artery disease is the most common cause of a heart attack. Other health conditions increase your risk of developing heart disease or having a heart attack. Now, let's delve into the risk factors that make heart attacks more likely. Risk factors can be divided into 2 categories: modifiable and non-modifiable. Non-modifiable risk factors are those you can't change. These include your age, family history of heart disease, and your gender. The good news is that you have control over many risk factors. Part 1 of modifiable risk factors includes hypertension, high cholesterol, and diabetes. Part 2 covers lifestyle factors that play a massive role in your heart's health. Smoking, poor diet, physical inactivity, obesity, and excessive alcohol consumption can all be managed to reduce your risk. Did you know that not all heart attacks are the same? It's a complex subject, and understanding these distinctions is vital. We're going to unravel the mystery and explore the various types of heart attacks and what you need to know. There are 5 different types of heart attacks. The 2 primary types are STEMI and STEMI. STEMI is the more severe type. It occurs when a coronary artery is completely blocked, leading to a large portion of the heart muscle being deprived of blood and oxygen. A STEMI heart attack causes progressive heart damage and requires urgent medical attention. And STEMI, on the other hand, is less severe. It happens when there is a partial blockage in a coronary artery, resulting in a smaller area of the heart muscle being affected. Even though these types of heart attacks are less harsh than STEMI heart attacks, they can cause permanent damage too. The first and most critical step in treating a heart attack is calling 911. Don't hesitate, it's an emergency. The faster you get professional help, the better the chances of a positive outcome. While waiting for emergency services, it's crucial to keep the person as calm and comfortable as possible. They should sit down and rest, and if available, administer oxygen to ensure an adequate supply of oxygen to the heart. If the person isn't allergic to aspirin, you can help by providing them with 1 adult aspirin tablet. Chewing it can help reduce blood clot formation and improve blood flow to the heart. Once in the care of healthcare professionals, at the emergency facility or hospital, you'll quickly get drugs to avoid further blood clotting in the heart and ease the strain on the heart. Drug therapy aims to break up or ward off blood clots, stop platelets from collecting and sticking to the plaque, stabilize the plaque, and stop more ischemia. These may include nitroglycerin and thrombolytics. Doctors will conduct diagnostic tests, such as electrocardiograms and blood tests, to confirm the heart attack and assess its severity. These tests help guide the treatment plan. In some cases, interventional procedures, such as angioplasty and stent placement, may be necessary to restore blood flow to a blocked artery. These procedures are typically performed in a catheterization lab. A balloon-tipped catheter is inserted into the blocked artery in the heart. The balloon is inflated gently to press plaque outward against the walls of the artery, to open the artery and improve blood flow. Most of the time, this is not done without putting in a stent. In this procedure, a small tube is inserted through a catheter into a blocked artery to prop it open. The stent is usually made of metal and is permanent. It can also be made of a material that your body absorbs over time. Some stents have medicine that helps keep the artery from getting blocked again. You might have bypass surgery in the days after a heart attack to restore the blood supply to your heart. Your surgeon will reroute blood flow around your blocked artery, usually using a blood vessel from your leg or chest. They can bypass multiple arteries. Heart attack patient usually stay in a CCU for at least 24 to 36 hours. Once past the critical phase, you'll continue to get a variety of drugs including antiplatelet agents to prevent disability worldwide. According to the World Health Organization, stroke is responsible for approximately 11% of all deaths globally. This translates to millions of stroke-related deaths each year. Stroke incidence is on the rise, and it affects people of all ages. The Global Burden of Disease study estimates that the number of stroke cases worldwide increased by 70% between 1990 and 2019. This trend is partly due to factors like an aging population and changes in lifestyle and risk factors. Stroke rates vary significantly by region and country. According to the American Heart Association, high-income countries have witnessed a decline in stroke rates due to better healthcare and public health measures. However, low- and middle-income countries often experience a higher burden of stroke due to factors like limited access to healthcare, inadequate prevention programs, and changing lifestyles. Strokes occur when there is not enough blood flow to the brain, typically due to a clot or a burst blood vessel, leading to brain cell death. This lack of blood starves the brain of the essential oxygen it needs to function. This lack of oxygen and nutrients can result in brain cell damage or death. Strokes are sudden, serious, and require immediate attention, but many people are unaware of the signs and what to do. It is important that you have the knowledge to recognize the symptoms of a stroke, understand its types, and most importantly, know how to react in those critical moments. To diagnose a stroke effectively, you can use the acronym FAST. F for face, A for arms, S for speech, and T for time. The F in FAST stands for face. When diagnosing a stroke, check for facial drooping. Ask the person to smile. If one side of their face droops or they can't smile evenly, it's a potential sign. A represents arm weakness. Request that the person raise both arms. If one arm drifts downward or they can't lift it, this may indicate a stroke. The S in FAST signifies speech. When diagnosing a stroke, observe the person's speech. If it's slurred, incomprehensible, or they can't speak, this is a significant red flag. T is for time to call 911. If you notice any of these signs, even if they seem to improve, do not hesitate. Act quickly and seek medical assistance. Time is of the essence in diagnosing and treating a stroke. In addition to FAST, be aware of other symptoms such as sudden severe headache, trouble walking, dizziness, or vision problems. Stroke symptoms can vary, and not all strokes are the same. When someone with stroke symptoms arrives in the ER, the first step is to determine which type of stroke is occurring. Doctors will conduct diagnostic tests like CT scans, MRIs, and blood tests to confirm the stroke and its type. There are two main types and they are not treated the same way. A CT scan can help doctors determine whether the symptoms are coming from a blocked blood vessel or a bleeding vessel. Additional tests may also be used to find the location of a blood clot or bleeding within the brain. Strokes come in different types, but for our discussion, we'll mainly focus on two: ischemic strokes and hemorrhagic strokes. Ischemic strokes are the most common type, accounting for approximately 87% of all strokes. They occur when a blood clot or plaque buildup in an artery restricts blood flow to a part of the brain. Ischemic strokes are often preventable through lifestyle changes and the management of risk factors such as high blood pressure, high cholesterol, and diabetes. Medications like blood thinners and procedures like carotid endarterectomy can also reduce the risk of clot formation. Hemorrhagic strokes are less common than ischemic strokes but tend to be more severe and have a higher mortality rate. These strokes occur when a blood vessel in the brain ruptures or leaks, leading to bleeding into the surrounding brain tissue. This type is less common, accounting for about 13% of all strokes. Hemorrhagic strokes are often caused by conditions such as uncontrolled high blood pressure, aneurysms, arteriovenous malformations, and head trauma. The sudden bleeding can put significant pressure on the brain, causing further damage. Strokes are sudden, life-altering events, and recognizing the signs is not just informative but could be a matter of life and death. Strokes come in different types, but for the purpose of recognizing the symptoms, we'll mainly talk about two: ischemic strokes and hemorrhagic strokes. In addition to FAST, be aware of other symptoms like sudden severe headache, trouble walking, dizziness, or vision problems. Stroke symptoms can vary, and not all strokes present the same way. It is important to know that the symptoms of the stroke are dependent on what portion of the brain is damaged. During a stroke, whether it's an ischemic stroke or a hemorrhagic stroke, the specific location and extent of the damage will determine the effects on the right and left hemispheres of the brain. A stroke that affects the right side of the brain can result in spatial neglect or hemineglect. This means the individual may neglect or fail to recognize objects or people on the left side of their body or environment. Right brain injuries can lead to difficulties in visual processing, making it challenging to judge distances, recognize faces, or understand spatial relationships. The right brain plays a crucial role in emotional processing and social awareness. Stroke patients with right brain injuries may experience emotional lability, characterized by rapid and unpredictable mood swings. They may also struggle to understand and respond appropriately to social cues, leading to social challenges. The left hemisphere of the brain is primarily responsible for language functions. A stroke that affects the left side can result in language impairments known as aphasia. This can lead to difficulties in speaking, understanding spoken or written language, or both. The left brain is associated with logical thinking, analytical reasoning, and problem solving. A stroke that damages the left hemisphere can result in challenges with tasks that require logical thought processes, planning, and executing complex tasks. In both right and left brain injuries during a stroke, there is often a corresponding motor deficit on the opposite side of the body. For left brain injuries, this means right hemiparesis, which is weakness or partial paralysis on the right side of the body. To understand the causes, it's vital to recognize the risk factors for ischemic strokes. Hypertension, high cholesterol, smoking, diabetes, and obesity are common risk factors. In contrast, hemorrhagic strokes occur when there's bleeding in the brain. These are often caused by conditions like uncontrolled high blood pressure, aneurysms, or arteriovenous malformations. Understanding the causes of hemorrhagic strokes also involves identifying their risk factors. High blood pressure, illicit drug use, and a family history of aneurysms can increase the risk of these types of strokes. And now we'll navigate the world of stroke treatment, from the initial response to the long-term care, because this knowledge could make all the difference when it counts the most.
Every second counts when seeking treatment for a stroke. When deprived of oxygen, brain cells begin dying within minutes. Emergency treatment for stroke depends on whether you're having an ischemic stroke or a stroke that involves bleeding into the brain. At the hospital, one common approach for ischemic strokes involves the use of clot-busting medication, such as tissue plasminogen activator. This medication can dissolve the clot causing the stroke, but it needs to be administered within a specific time window from the onset of symptoms. Endovascular procedures, such as catheter-mediated intraarterial thrombolysis or angioplasty and stent placement, are also used treating ischemic stroke. For hemorrhagic stroke, which is caused by bleeding in the brain, the treatment aims to stop the bleeding and reduce the pressure on the brain. This may be done with surgery, such as aneurysm clipping, coil embolization, AVM removal, or decompressive craniectomy, and medication, such as blood pressure-lowering drugs or drugs to prevent seizures. After the initial treatment, stroke patients may need rehabilitation to recover from the physical and mental effects of the stroke. This may include speech therapy, occupational therapy, physical therapy, and cognitive therapy. Lifestyle change are crucial also in stroke patient rehabilitation to recover. Prevention is key for both heart attacks and strokes. Lifestyle changes such as a healthy diet, exercise, managing blood pressure and cholesterol, and avoiding smoking are crucial to reducing the risk of both conditions. In conclusion, understanding the difference between heart attacks and strokes can make all the difference in the world when it comes to recognizing the symptoms and acting promptly. Remember that every second counts.